Imran, so what do you think is the role of neuropsychological assessment in pediatric epilepsy?
Because see, from birth till 25 years of age, you have a lot of psychological and developmental batteries which you can administer to these children. For example, simple cognitive evaluations are to be done. There is a scale which is called a Bailey scale of infant and toddler development, isn't it? There is a scale which is called, for example, Vineland social maturity scale. It is for adaptive behavioral evaluations. There is a scale for intellectual assessments, for example, Mellon's scale or Wechsler's scale. Similarly, there are scales which are for anxiety. There are scales, for example, what Dr. Deepak was saying, that some kids have other comorbidities also. We have a child with seizure who is also having OCD. Okay, so once the school has referred that child to us because he has a decline in academic grades. And when we started administering the batteries of psychological and developmental batteries to him, we did one CY box for children, isn't it? And it was clear that he is having definitely some symptoms of OCD as well. So starting from zero, it's like basically 16 days. You can start one developmental evaluation, which is called a Bailey scale of infant and toddler development, up to the age of 3.5 years. You can use Gazelle developmental schedule, in which there are domains, for example, motor, adaptive, personal, social, and language. You can use intellectual evaluations. You can use evaluations for attention, this mapping, because attention is majorly impaired in 30 to 60% of children with seizure. And then you have to be very careful about the educational evaluations, because they will have problems in coding, decoding, memory, recall. So for that, there is NIMHANS battery of learning disorders. So you know that these children have comorbid condition of attention, academic difficulties, social skills, and then behavioral concerns related to anxiety, stress. So all these things can be evaluated. As a neurologist, you will do the medical evaluation for seizure, but as a psychologist, we can do evaluations for all these domains one by one. If you tell me that how is his memory 6 months and now, post and pre medical interventions, we can map it properly. There is something which is called cognitive mapping, which can be done easily for every child. And it has wonderful. See, not only the assessment is important, after assessment, you will be able to make a plan of intervention for that child as per his level. And that has wonderful results, because once you go individually for every single child, along with a neurologist, along with a psychiatrist, then you have a wonderful result in the children with seizures.